Well, welcome everyone to our Southwest Collaborative Planning meeting. We're very excited to be here with you today, and we definitely appreciate your time joining us. I'm going to pass it over to Rachel McCullough-Sandin, our program manager for this body of work. So Rachel, do you want to take it away?
Thanks, Catherine. Welcome, everyone. I'm really excited to be here with you. Catherine Stewart is our director of our Learning and Action team at Phil, and joined with Sue Grinnell, our director, and a number of amazing colleagues, and mostly grateful for all of you. We know that we come together to collaborate and share both issues, workarounds, and solutions for our topical implementation issues for the enhanced care management and community support services under the CalAIM initiative to improve Medi-Cal services. All right, next slide. It's important that we have our land acknowledgement, and the Population Health Innovation Lab team respectfully acknowledges that we live and operate on the unceded land of Indigenous peoples throughout the U.S. To learn more about the traditional territories of tribes where you are, click on the native land map that will be posted in the chat. It's a great place to go. You can enter your address and see which tribes historically and currently are in your area. Next slide. So let's do a check-in. In the chat, raise your hand, unmute yourself. We would love to start our day checking in and sharing successes with one another. So this could be work related. It could be how you've solved all of the ECM and community supports issues, or it could be personal. What has you on a high today, this week? Maybe your souffle came out perfect. Maybe you have either made or danced salsa. What is going on for you that you would like to share with the group?
Well, I'll go. So Petaluma last night launched the Blue Zones, which is a very exciting 4.5-year project to help people in our community live longer, happier, and healthier lives.
That's awesome.
That is awesome. Elise, who's leading that effort? Yeah, that's awesome.
Well, so I'm taking off this hat and putting on my healthcare district, the Petaluma Healthcare District in the city of Petaluma have launched it. So
that's awesome. Yeah, I know Adventist has like purchased Blue Zone, so that's interesting. That's great.
Yeah, we're excited.
Congratulations. Nancy.
I can go since I'm unmuted. Like, I'm very excited because I made a rhubarb, strawberry, blackberry, blueberry pie. It was amazing. I was just going to do strawberry and rhubarb, but I was like, oh, I had some other berries. So love the summer and all the berries.
That is perfect. Nancy.
Hi, everyone. I just wanted to say that we are new to the group. I'm representing Marin Center for Independent Living, and we have been accepted by partnership. Just our successes are very small to start with for ECM and community supports. And we were accepted to the TA marketplace. So right now we're in the process of interviewing TA providers would love some direction at some point. If anyone can give us some on that, that's later, but we're kind of confused if people are only, approved for 2 of the services and we need some that aren't in there. Do we need a second? And so anyway, early on, but excited to be part of this group.
That's great.
Fantastic. Definitely a resource that is great to take advantage of, and would love to learn more and share more with you, Nancy. Kim.
Hey, it's nice to see everybody. So I just really want to talk about the success in ECM through CS. We have currently built capacity up to 70 now, folks that we're serving, and but all along the way, I got to see from the point of referral, we housed 10 people successfully into permanent housing last month, and also with the ECM case manager, housing navigator, community supports, resourcing and networking, creative funding for housing, and have been able to get folks into housing. And we have a great new resource, 2 of them, where people are able to get their home once they go into permanent housing furnished. There's 2 resources. One is called Inspired. I have the resources I can send out to everybody. And the other one is called Make It a Home. So it's this whole full circle. It took a whole lot of work. I'm really, really tired. So is the team, but like this was our first real successful opportunity to see folks get into a way and employment so they can sustain it. So and it took us pretty much 6 months to get sort of the pieces. I mean, we still have lots of learning to do, but people were housed successfully and set up to sustain it. So we're going to share that with the group, and yeah, it's exciting.
Fantastic. Thank you so much for sharing, Kim. Your organization is always doing amazing things to find ways forward and make connections.
Hello, everyone. This
Oh,
is
good.
Norma Lusenko with Innovative Health Solutions. And my success is that I'm finally connected to this collaborative. So this is my first meeting. The way this program has been working, where there's so many delays with everything, I'm just excited to be here and looking at everyone who's part of this. Hello to those who I know and know me, but I'm just excited to be part of this collaborative. Finally, Innovative Health Solution was contracted to provide medically tailored meals, community supports in January, I believe, with partnership here in Solano County and Napa County. So we have been connected with the collaborative that is with Solano. So this is the Napa, which is for us is going to be, a little a struggle, because now we have to be part of 2 collaboratives, separate collaboratives. So anyways, so that's my success for today.
Fantastic. Norma, I'm so glad you're here. And if you find other things that are helpful with the Solano collaborative that we should be incorporating, we are always open to feedback, and we really look forward to connecting with you and getting to know you more. I'm so glad you're here. All right. Thank you so much. What a wonderful way to open our meeting and connect and start sharing stories. We'll be asking for feedback, and there'll be lots of opportunities along the way. Today, we have a short meeting, our virtual hour-and-a-half meeting instead of our in-person meeting, which we're really looking forward to with you next month. So we've got some concrete information to share and some great updates. Let's go to the next slide. So our objectives today on the right-hand side in green is we really want to be understanding some of the issues that Partnership Health Plan and DHCS are actively addressing for ECM and community support services, especially in response to providers. And we want to be able to share the system we have for our collaborative for gleaning issues and sharing workarounds, advocating for solutions, and completing that feedback loop here. We want to share more about the services that we offer each of you. And so we are here to help you. We are here to serve you and bring us all together and follow up to be able to concretely work together. And so we'll be going over those services. And then we are going to be having a brief intro for process mapping, which I know a lot of you are familiar with and many of you have probably already done, but also to be able to gauge interest. In the past, we have heard that you are interested to either learn and understand more about processes that are out there and have this visual mapping represented for those, but also you may be interested in developing them own for your own organization or the networks you're interacting with. So we'll gauge that level of interest for future planning. So we will be having those updates and going over the feedback loops and the process mapping, quick review of the asset mapping demo that we did a couple weeks ago and next steps. All right, next slide. So as a quick review, we are facilitating 2 different collaboratives. We are here in the Southwest region of Northern California with Mendocino, Sonoma, Marin, Lake, and Napa counties. I'm very grateful you're all here. If there are other organizations or colleagues that you would really love to be a part of this or think they would benefit, please reach out to them and or give us their info, and we are happy to reach out to them. We really want this to be a space where everybody can come together. Next slide. So we have often provided a lot of background slides in previous meetings. We're not going to do that today. If you are new, we are so happy you're here, and we are very happy to meet with you and give you more background information. It's also available on our website. But as a quick overview, we are identifying our needs and gaps to be able to better deliver the ECM and community support services, resolving those topical implementation issues together, and also trying to avoid duplication with the other efforts that are happening in the region to support those gap filling plan efforts. So we as facilitators are responsible for helping overcome those challenges and conflicts together and being able to identify and disseminate successful practices that we all either are implementing or need to have. Next slide. Wonderful. So today, do we have our partnership health plan representatives are amazing and have been super involved and helpful, and we're so grateful for them. Lynn, Vicki, Danielle, Chloe, Ashley, there's a whole bunch. Catherine Power, I see, thank you. Do we have a partnership representative today to go over some of the wonderful updates? I see Ashley.
Hi, Rachel, this is Ashley.
Hi. I'm so happy to see you.
Hello.
Hello. I will pass the mic over to you and just let everybody know that if you remember our activities from May, one of the things we did was put together a bunch of issues, and partnership was really involved in those discussions, and they generously put a written response together that we posted on our website. And so that feedback loop is happening, and we want to be able to present that to you today, along with partnerships updates and also some great resources on their website. So Ashley, over to you.
Absolutely, thank you. Do you want me to share my screen on the issues that we can go over? Do you guys have them? I saw you put them in the chat. I can share my screen here. 1 second.
And as Ashley's doing that, we'll continue to put a lot of the links and resources we reference for folks in the chat. And I'm so glad that other participants are adding helpful links as well. And we are saving the chat, and we will be able to put relevant resources on our follow-up email as well, as long with our slides. And this document is available on our website at the bit.ly link in the chat. Ashley, go for it.
Perfect. All right. So yeah, I'm not going to go word for word because you can access this, but just to kind of give you guys some updates on the previous issues that were raised. So for enrollment tracking, the issue of your members not appearing in Collective Medical, which is our data sharing platform, in a timely manner. We did launch a pilot program with a few of our ECM providers And that was to give program the same list of ECM members. So one provider was able to log in and see the members that were already assigned to those other 4 providers that we're hoping is going to show a lot more transparency. It went well, so we are actually going to be implementing this for all of our ECM providers for July. So we're looking forward to that. We're hoping that fixes a lot of the transparency issues that providers were having. But please, if you are noticing that your members are not ever appearing in your collective medical or point click care, it's now called, in your portal, please reach out to us so that we can troubleshoot in a timely manner. And then next was our care plan development. So we did have a summit with DHCS last week. Nope, I'm sorry, that was June 9th. So we have expressed the change to leadership where a care plan might not be required when a TAR is submitted. So we are waiting for leadership's response on that. And then of course, we will let all of our providers know if there's a change there. But hopefully we're talking about presumptive eligibility, if that's a possibility at all. If we're going to be requiring just a small care plan and then a more extensive one after you've had time to meet with the member after they're technically enrolled. So we will keep you apprised on that movement as well. And then TAR and billing challenges. So we do have a great resource that was shared from one of our providers. So we are working with our claims and our PR staff in order to have them okay that document and share with everybody. But for right now, they are both very willing to provide additional training if needed or answer any questions. So the ECM claims help desk email box is there. And if you ever have any questions, Bonnie is more than willing to answer those and is pretty responsive. And then a potential member list from DHCS for risk stratification. We did take this to the summit on June 9th, and we are still awaiting official guidance. So there will be more information to come on that. So those were the issues from May. Let me pull up this next thing here. Okay. Okay, so there were a lot of questions on our ECM and community support provider directory, how to find the other providers that are located in your county or maybe another county. So we put together this directory how-to guide. It still needs to be approved by our communications department before it gets sent out, but we wanted to show you a little how-to here. So we've put a little bit of images here, but if you go into our partnership website, we do have a provider directory that has primary care providers, specialists, a whole plethora of providers are listed. And so we've incorporated our ECM and community support providers as well. So if you type the facility and indicate whether you are looking for an ECM or a community support provider, then you're able to then look them up just by the facility type, or you can then select a county and specify if you're looking for a provider within a certain distance from you. So I actually have that here. Let me show you here. All right, bear with me.
Actually, just a friendly reminder, I think you might get a new window when you open the directory. So it might, if you're going to share your screen, you might have to shift it another time, just so you know.
Thank you. Can you guys see that? Perfect. Yes. Okay, so here is our provider directory on Partnership's website. So if I was looking for an ECM provider, I would go down here to our enhanced care management, and then I'd be able to filter to, let's say, Shasta. You press search here, and then it shows you, once it loads, all of our contracted ECM providers. I do want to call out that we are in the process of updating this as well. So we have some additional requirements through DHCS to have a contact person listed in the directory. We're also hoping that we can indicate somehow the capacity so that if you're looking for a provider in Sonoma County that has capacity to take on a member, then you're able to look and see if this is their capacity. They are able to accept referrals. So it's the same process for community supports as well. Pretty simple and easy. Is there any questions regarding the directory?
Can you show us how to filter by county?
Yeah, absolutely. Let me go back to the first screen here. So type of facility, we'll do community supports this time. So you can select a zip code here, and then to filter to a county, you're just going to drop this down and pick whatever one you would like. And then you can also select a proximity as well. So 5 miles. I'm not going to select one because I don't want to guess a zip code. But here are the Solano community support providers.
This is so helpful.
Okay.
Does anybody have any questions for Ashley? Casey.
Hi, Ashley. It's Casey, Turning Point Community Programs. It's kind of a question and an additional ask to ECM and CS providers within each county. Currently, Turning Point is working and providing ECM services in other counties across California. And one of the things that we came up with and are starting to do is do kind of like case management calls, kind of taking like the housing authority or housing agencies case conferencing calls where we bring ECM and CS providers, all of the same area, geographical, county-based, bring them all together, and then community-based providers come together, and then we immediately link or connect the ECM member or CS members to the additional services or resources that they would need. I don't know if there is currently something happening in each county. If there is, I would be great if I could be included in those. If not, is there a way that we can start to develop that to where we have, every other week or twice a week or however frequent each person or each agency feels would be beneficial for us, so that way we could meet, talk about our members, get them linked, do updates, so that way all the ECM providers are able to get updates on their members so we can track all their case progress and their goal accomplishments and how things are going for them. Just throwing it out there as an idea. I know we have platforms that we can send referrals to, but I also know it's also challenging to then have other organizations get us the information back that we need to really see how our members are progressing. So it's just an idea. It's very, very much in the infancy. If there's already something going on, like I said, I would love to be a part of that. If we don't have anything, maybe this is the perfect platform where we can start to talk about that to see how we could develop that or work that into our counties.
Yeah, that's great. I love that collaboration. And yeah, I agree. There's already these meetings going on. So I will take this back. What counties are you currently in?
We are currently in Stanislaus, San Joaquin, Sacramento. We're contracted with Solano, Sonoma, Yolo, and I'm waiting here back from another MCP for Butte, Placer, and Nevada.
Okay.
Wonderful. Anybody else with questions or requests for Ashley? Also on the partnership website, the ECM and community supports resource pages have been separated. And so please, there's a bunch of links in the chat, and you can go there for webinars, trainings, registering for roundtables. Anything else you'd like to say, Ashley, about your website or helpful resources that you often recommend to folks?
I can't think of anything else. Yeah, definitely. If you have time, take a minute to look around our PHC website. We did, like Rachel said, break out the community. Partly in control of updating that webpage. So if you have anything that you think should be posted on those, please take that or bring that to us, and we'll take it back and see if we can make that happen, because we want this to be a useful tool for you to utilize.
Perfect. Thank you so much. All right. Okay, Ashley, thank you. It's so wonderful to have partnership, engaged, responsive. I think we are a really lucky collaborative to have such support from the managed care. And we know everything's not perfect, and we know everything's not in your control. And you guys are fighting some policies just like the rest of us, but it does seem like we are trying to do our best together. And that is especially helpful. All right. So we feel it's our greatest responsibility to complete the feedback loops and respond to the systemic and technical issues and challenges that are raised. And so we want to be able to share that process and our progress as a group together. Next slide. So we've all seen this slide a few times if we've been around for a while, and through discovery calls and emails and listening sessions, we have these mutual challenges, many of which we share, some of which are specific to types of organizations or a specific organization, but we have these groups of technical, relationship, and billing issues, and also systems opportunities and wishes for improvements. And so we do have a larger report on these that were developed a few months ago, but we didn't stay here, right? So we took what we heard, we've had activities planned, we've developed these drivers and ideas to continue to systematically and strategically move forward together. So next slide. Last month, this will look familiar to a lot of you. One of the things that we did was share more about these systemic challenges and then also solutions that some of us have been finding. Partnership was very engaged. And so one example of this simple feedback loop is what we just saw. And partnership really engaged with these items, created the document and got it back for us to be able to transparently share with all of you. Next slide. And so we have this simple and one of our most important feedback loops in this CPI collaborative together with partnerships, amazing relationship, and participation. And so our conversations and other sources of information as we continue to interact together through us and also directly with partnership, and then their responsiveness within their powers and resources. Next slide. So that document that Ashley displayed and we put the link to in the chat is available on our CPI resources page at Phil. That is also there. And so we can see that we are making progress together, bits at a time. But of course, there's lots of issues. Next slide. So on the back end, we have taken all of those issues from earlier in the year, from these recent activities, from those conversations. We want to emphasize that those are not just laying flat somewhere and talked about and then forgotten and moved on. We have been documenting those and categorizing them. So we know that there's different system levels that these issues may be at, right? So it might be a technical platform, or it might be an organization specific issue. And so we've heard some CBOs be concerned with financial sustainability or FQHCs and billing, or a specific organization with where they are in this process. We also know that there are intra-county issues. We are a region. We've been able to see on our asset mapping and other conversations that we definitely have cross-county service issues and opportunities, whether it's clients moving or various resources being available across county lines. But we also know, and I'm also saying this as a former county employee with public health, that there's a lot of county specific issues, systems, networks, coordination. And so some of these are very county specific issues, regional, and then policy. We know, like with these care plans before or after enrollment, that is not something that we decide here, but that we advocate for. And so some issues being able to take up to DHCS through partnership, through our state administrator, through the CPI PCG public consulting group, we speak with them. They also speak with DHCS. So it's helpful to understand the levels at which these issues are taking place, of course. And then categories, billing, referrals, care coordination, et cetera. And the way that different types of issues have different needs for finding solutions. And so as we track all of these, it's important to both note the current workarounds that we have and that we can share together, but then also the solutions, the desired solutions, the feasible solutions, and when they may be able to take place. So it's a lot to organize and track, but we have developed this system in the back end that is a structure for it. And it's wonderful that partnership is really involved. And so we want you all to feel confident that as we continue our work together, that we are able to move forward and change is happening. Next slide. So this is a visual representation of some of that. And so we know that we're getting information through these monthly collaborative meetings, the one-on-one and group calls that we're having with you. We would love to follow up on some of the previous calls that we've had. If you're new, we would love to learn about you and your organization and what you need. So we'll be reaching out. Please always reach out to us. We have our PATH email and our personal ones and professional personal. And then the ECM roundtables we are attending so that you don't have to say the same thing in multiple places. We want to avoid that duplication. And so we are collating what we're hearing in our tracking system, noting those current workarounds as we're sharing those categorized issues with Partnership Health Plan and PCG, who both interact with DHCS. And then we have our internal team that can also offer services, and I'll get to those concrete examples. So we're looking into those future solutions and the progress being made on those. And we want to make sure that those workarounds and solutions are shared back here with you all. Next slide. So we've shown this before as well. A lot of the strategies that we're moving forward with fit under umbrellas of support strategies, capacity building, collaborative systems improvements, relationship and network building. So the relationship and network building is a lot of what's happening here every month, but of course in the smaller forums. And then how we're moving forward together with capacity building services that we're offering and these collaborative systems improvement approaches. Next slide. So this is really important, and I really want to pause here and give an opportunity to offer a concrete menu. And some of these we have discussed directly or inferred, but we really wanted to pause and go over, again, what we're here for. So we are at Phil, the facilitator for this group, and we have expertise in our group that we want to be able to make sure that is at your disposal for free as part of this process. So yes, we're here for monthly convenings and breakout conversations. We can bring in guest speakers and subject matter experts, either people we're familiar with from our partnering organizations, or if there's a certain topic that we feel would be helpful or that you have recommended to us directly. We're available for one-on-one technical assistance. We have helped review grant applications. We have helped steer people towards resources in the TA marketplace by accessing either off-the-shelf packages or vendors who specialize in certain areas. If you have a meeting in your organization that you would like help facilitating, we have some expert facilitators on our team and can help those conversations and processes take place. And And that may be a meeting, it may be a process. So to be able to support quality improvement efforts, whether that's a PDSA cycle or a process mapping exercise, which we'll also be talking about. And then continuing to disseminate resources from partnership and DHCS. And so, and being that source of information. And we know that you can get it directly, but sometimes it's helpful to have it coming from different places. So I want to pause there and just see if anybody has questions or any clarifications or have additional ideas about how we are tracking what we're bringing to this group, what we're getting out of it, and how we can all leave here with more than what we came with, and continuing these follow-up efforts and making sure that you all have what you need to be successful with ECM and community supports. Questions, clarifications, suggestions, brainstorming. Would love your feedback.
Thanks, Rachel. I just want to reiterate too that, we really are here in support of you. So I think, we would love to hear what it would be that would be most helpful to you. So please don't hesitate to reach out or speak up. And, we certainly are not the experts of everything, but we would welcome the opportunity to try to help troubleshoot any issues that you guys are having, and work to identify those that could be the expert on the thing that would be most helpful.
Thanks, Catherine. I just want to add, because I think I'm not remember, because there's so many meetings, you all have solutions as well. So I encourage you, like if you've come up with like this most amazing way to do something, like bring it forward and let us know in service to all of the others that are here. So.
Absolutely. The peer-to-peer learning has also been very valuable in this forum, and we really appreciate that. And Nancy, thank you so much. Who do we reach out to for these resources? And Max, one of our Merlin team members, put our PATH email there in the chat. So path@pophealthinnovationlab.org is always your easy portal to be able to ask for help or connections. We also have our individual emails on our slide at the end, and you're always welcome to reach out to any of us who you're comfortable with or would like to follow up with. Thank you, Ken. That's very kind. Ken said, I'd like to thank fellows. They were instrumental in helping review the grant for us. We desperately needed help, reached out and received it. And that was a huge effort that Stephanie Hartsfield, our consultant, and Jessica Sanchez, our program coordinator, helped with Kim, and that was fantastic. I think that was the week I had COVID. Who else? All right, we are here for you. If you have questions, suggestions, chats, please feel free at any time. We just wanted to make sure that that was concrete for everyone. All right, next slide. So now we have some DHCS updates for you. And so we had a large meeting across the state of California with the other facilitators that had these CPI groups in other regions of California. And so that was hosted by PCG, and DHCS came in, and I was a big part of that meeting. And they went over some really helpful updates of issues that they've heard from you through us and the managed care plans as well, and went over some possible solutions they're working on. And so we wanted to give a brief overview of that. I'll turn it over to Stephanie Hartsfield, our wonderful consultant, who tends to be in the know of things that are getting updated and happening. Stephanie?
Thank you. Yes, and I think all of you know a lot of these things as well. So, feel free to chime in And I just want to take a minute, again, thank everyone for collaborating and the presentations. And also to say that we clearly have a very magical team working the chat. So if I use a term that you're not familiar with, I know we have some new people here, or an acronym, that this work is just fraught with terms and acronyms and everything. So don't be shy to throw in the chat or to just speak up and ask for something to be defined, because this is it's not just you. Probably there's 10 other people who don't know what we're talking about. And also the theme of today is really to say that people are listening and we heard you. And this is kind of an exciting time. Ashley mentioned a little bit of it, but for those of you who have been here a long time, one of the original questions was always, is this going to get up to DHCS? Are they going to hear us? And we're here to say yes, that they are listening. Okay, we can go to the next slide. So Ashley mentioned that partnership was at a meeting on June 9th, and that was a very special meeting. I think they may have had 1 or 2 of these before, or maybe 20. I don't actually know. But that meeting was DHCS meeting with all of the managed care plans at once together. So I think that is very important. Or we know it is. And they were saying, look, we've done a lot of listening, we've gathered a lot of feedback, and here's the themes we're hearing. Here are the things that we're hearing that we feel like really need to be addressed. And we're hearing them from the top down, and we're hearing them from the bottom up. So things have to be fixed in different ways. And we also hear you, MCPs, and we know that it's hard. So that was really fantastic. So that was on June 9th. And then on June 12th, as Rachel just mentioned, they met with all of the what are called CPI facilitators. So there's 25 different regions, which some of you know, because as I think Norma mentioned, some of you have to go to 2 or 3 of these meetings, and we're trying to work on ways to streamline that because we really don't have time. And I was sad that Sage wasn't at our meeting yesterday, but she's here today, or they're here today. So that's fantastic. Because I know the roundtable had a lot of questions. Anyways, so they hear us. That's the main point. So what we heard from DHCS is that through all of their listening sessions, that they realize there are some things that they really need to make work better for everyone through ECM and CS to really get it right. And what you see here on the screen is the major categories that they want to address them through. And we are allowed to share some information with you. Well, we can't share slides because it's not final. So I have to emphasize that. It should all be finalized in July, is what we hear. And our goal is to have a panel of folks from DHCS come and present in August for all of you so that we can hear it straight from them and ask some questions and just really get the info straight. But I'll give you a quick overview and highlight. So you can go to the next slide. So I have to say with everything, oh, whoops, no, don't go to the next slide. I'm just going to talk it. Sorry, because I forgot I can't show you anything. So some of this may change. All right, let me go through the categories. So these are the major themes that they have noticed in their listening sessions. So for standardizing eligibility, this has been a rough road. So that what they're seeing is variation in how different managed care plans are kind of applying the population of focus criteria. So if you're in an area where you have to work with 2 different or 3 different managed care plans, it's very confusing. So that's reducing the number of people who want to even become ECM or community supports providers. So they're going to reinforce the expectations and try and streamline that. And that's on ECM. And for community supports, they are also hearing that some managed care plans are narrowing the eligibility criteria relative to the service definitions, and that's not okay. So they're going to kind of hone in on that and try and make sure that doesn't happen, because you don't need anything narrowed any more than it already is. So that's one of the things they're going to look at. So the next category really is about authorizations, and we've certainly heard a lot about TARS and all of that. So referral and authorization process, the steps that they are planning to take is the managed care plans have different timeframes for initial authorization and reauthorization. So there's not parity among managed care plans. So they're going to standardize authorization and reauthorization timeframes for both ECM and community supports. So this should all start in July if all goes well. So I think that's something to really look forward to. Also for presumptive authorization.
July's in 3 days.
Yes. Is that Amy? I can't see a second. Yes. I don't think they never said July 1st.
Okay.
Yes. And this has been in the works for a bit. And I think the impression I got is they have most of the managed care plans on board, and not 100%. And also that's the timing of like certain board meetings. So I think that board meetings have to happen because this has to be approved at the highest levels. But I get the impression, just the way large system works, is that DHCS is saying, this is what you need to do in order for the money to flow. So then let's say the CEOs have to go to their board and it has to just go through this formal approval process. So that's why they're saying none of this is definitely going to happen, but they are working hard. But not July 1st. Yeah. So let's keep our fingers crossed. That's what I would say. So presumptive authorization, that one, they use the word strongly encourage, not mandate. But I know that for those of you maybe in street medicine or street outreach, they really want to get more street authorization to work well. Or to kind of be an uptake, I guess. And then they are working towards statewide referral standards, and they're going to start doing that in third quarter, which, around September this fall. And I think that will help all of us, but that one is not coming in July. So expanding provider networks and streamlining payment, I think just knowing this is in the works. So they want to address the fact that there's not consistent reimbursement for outreach. And I think Sage, I think this is something that we all heard at the ECM roundtable. And I want you not to, I know that this is not partnership. It's everyone. And I think DHCS is recognizing this is a huge burden on all of you. So they are really trying to get this consistent. You can imagine the conversations they're having to have. And I think this is why it's not July 1st, but they are working hard towards that. They are also working on reinforcing the timely provider payment requirements. So I know I also work on the ACEs Aware grant, and some of these timely payments are a problem, and this is kind of other parts of the state. So they're working hard. I guess that's what I'll say, right? They also want to make sure that the awareness building is happening. They call it market awareness. And I think that's part of our role and all of your roles. But if things are really challenging and it's a huge administrative burden, you're not going to tell all your other colleagues like, yeah, go for it. It's fantastic, because we're still working out a lot of kinks. So they are just going to try and figure out how to be more supportive, both of the MCPs and of all of you and the facilitators, to get a lot more awareness and uptake to see how they can support that. I have noticed that their slides are getting really good, a lot better. And I'm asking for them to come out sooner on some things, like I'll tell you on the next section. And then improving data exchange. I thought this was interesting because we're coming up on a big time of data exchange, especially in 2024. And one of the things they mentioned is that many providers, and when I say provider, I mean any kind of provider, not necessarily medical, but they just call anyone who's implementing this work a provider. CBOs, they're being required to document a lot of the detail of their ECM and community supports delivery in plan-specific IT portals, and that's a requirement. And they are saying that the MCPs can't require that documentation in IT portals because it's creating undue burden on a lot of the providers. So again, not final, but that's one of the items. So that's around documentation. And then just making sure for any or all of you who provide community supports that there is an updated community supports information sharing guidance document that came out in April. I'll put a link in the chat to that. So if anyone needs that, they're trying to make it easier on folks who are doing community supports. Any questions that I may or may not be able to answer on what is likely coming sometime in July? Okay. And then, oh, go ahead. Yeah.
Yeah, Stephanie, hi. This is Deepak. We work with a few ECM CS providers, helping them on all these things, eligibility, authorization. So one thing which we've noticed is that new new data exchange MIF RTF files have already started to come in from health plans. We were hoping that since these are the new MIF RTFs, they'll be more consistent, but we're still seeing differences in the file formats, what columns they're representing. So I just wanted to wanted to check in, if you think the whole authorization referral process, how standardized do you think they're going to be? Are they going to have differences like we're seeing in the files, or you think they're going to be much more like even like referral forms? Are they going to get standardized, or is it just about the timing authorization?
I'm quickly scanning my slides, and once I'm not presenting, I'll double check again for you. I am 99% sure that is one of the items that are on there. So the RTF files, the TARS, they are looking to get those a lot more streamlined, because that is one of the administrative burdens. Because if you're in LA County, or even if you're an organization that's in, Solano and Yolo, and you're also in Sonoma and Marin, you've got two different MCPs. So it is a huge administrative burden. So I am pretty sure that is one of the things they're standardizing. So yeah, like you said, the columns, the data loads, they're looking at that. But I will double check, but you wouldn't see it yet. For it all to be standardized, you won't see it until this mystery date in July, because they're still negotiating some of the points of things. But yeah, I'm pretty sure, Deepak, that's coming.
Thank you.
That's a good question. Okay, I'm going to go into my next slide. Feel free to put questions in the chat, because I don't want to take too much time. And then I think most of you probably know that the pediatric ECM population of focus is starting July 1st. That is starting July 1st. Amy probably knows way more than me about it. There were actually some really fantastic slides on the webinar last Friday about this population of focus. There are 690 people on that webinar. It was well done. I'm trying to get a copy of those slides sooner, because it takes about 4 months for DHCS to post their slides. Anyways, but just as a quick overview, these are the details of the populations of focus that are coming online. And if anyone knows, there are two of them that are starting later, and I didn't write it down. They're starting later than July 1st. Feel free to put it in the chat. And so if you're already an adult ECM provider and you want to add on these populations of focus, there's an attestation form that partnership has you fill out. And I just want to say, it's no requirement, and you don't have to do it July 1st. You can do it 6 months from now. It's just something to think about, is, does our organization want to add on children? Do we want to start with children? But just know that these are the categories, and you don't have to do all of them. You can do just one if it makes sense for your organization. So this is an upcoming opportunity. Oh, thank you, Amy. I knew you'd know. And if anyone, well, I'll also put in the link for the model of care for the pediatric ECM population. That has all the details in it. Okay, I think I have, next slide. I just want to quickly go over, there's some funding opportunities, which some of you may or may not know about, and we'll send all these slides out. So I'll just mention them quickly for folks who may or may not know. This one's coming up soon, the deadline, the traditional Indian health request for applications. This kind of has a tie-in with education. So that's a nice one. I think 50 to 100,000 per organization. The data exchange framework, the data sharing agreement grants, those have only been for required sign-on folks so far, coming in July, no dates. Non-required, like social service organizations, counties, and others will be able to apply for these grants to help people with signing on to the data exchange framework. So that's something to keep an eye on. There will be, I know a lot of you applied for round 2 of the cited grants. Oh, that was good. Whoever went on to the next slide. Yeah. So I did get the dates for round 3 and round 4 are out, and round 4 is the last round as of now. And then IPP, that's when those will open up. And I put a link to the funding opportunities cheat sheet, which does not list all of them, but it lists a lot of them. But you still have to watch the 20 emails a day from DHCS, which we will also watch for you and send out. Okay, I think that's it for me.
Stephanie, are you saying in that slide that round 3 will open before round 2 is announced?
That, according to the calendar, yes. Which
that was the similar. So this just not that I am like wanting to be the pessimist that I am in my soul, but they had mentioned that for the round 1, 2, and they kept pushing the round 2 opening until they had at least 1B submitted or 1B announced.
I know, Amy, I have the same feeling as you, so I guess that's a really good thing to bring up. I feel like it is going to get pushed. And to answer Kim's question, I feel like it says October, but I've heard from the applicants that they feel like they'll hear in September.
They had said September was what they had. That's what PCG had said.
Yeah, so that's at best going to be announced in September, but I know they got a lot of applications, right? So, and we have someone from PCG on the phone. Actually, Tiara, do you want to speak to that? I don't know if she's there. I put her on the spot.
I can follow up with our PCG team.
Oh, thank you. Yeah, so I feel like it could get pushed, but I checked a few different places and as of yet, it has not. So I agree, Amy. Yeah.
This is Sage. That is, it says September on the application for announcements, and then October is a tentative like start date for funding. But if there were so many applications and they don't know who they're going to award for round 2, how do you know whether or not you should apply for round 3 if you don't? Anyway, that's okay. But hopefully it'll get pushed back until we know whether or not we need to apply.
Right. Hopefully it will. And I don't want to put Tiara on the spot, but these are good questions. Like, Tiara, do you have any idea how many applications came in? Or I don't know if any of that's even public.
Yeah, so that's actually with our cited team, not with our collaborative. So I can drop their email in the chat just for you all to reference.
Thank you so much. Yeah, thank you. Great questions, all of you. I hear you 100%. Yeah.
All right. I think the questions in the chat have been answered with as much information as we have. That cited email will come through. And again, we can continue digging into things that are important for each of you to be able to have enough information to move forward in your own processes. Thank you, Tara. All right, cited at ca-path.com. So let's do a quick check-in. We will launch a quick poll. We've done this a little bit before. And so it is important to understand where you're coming from and where you're going. Many of you have seen our readiness roadmap that we are tracking progress with through our CPI collaborative efforts. And so step 1, we know a few of you are figuring out what ECM and community support services are, and then moving on from there of exploring the contracting process or applying with step 3 on this map, getting contracts. Congratulations to those who have recently been awarded. And then 5, testing it out, getting systems ready. And number 6, implementing, making it work, but still having understandable issues or challenges. And then, of course, that last step is everything is working perfectly and seamlessly, and you have your coordinated care system and everything is in place in the way it should. So we've got a quick few questions where we would love everybody's interaction and responses. And so when did you first start coming to our collaborative? Was it back in January, having listening sessions? Is it your first time? Welcome again. And then when you first started coming, where were you on this roadmap and where are you today? And so as we see people progressing, we can reach out and see what your secret sauce is. If we see people are kind of at one step for a while, being able to reach out and just see what kind of other services or assistance or resources you may need. and being able to share lessons learned and successes together. So I'll leave that open for a couple of minutes. You can scroll through each of the questions at your own pace. And we can look at those results together in a couple of minutes. Looks like we've got about half of our folks done with the poll. We'll leave it open for another minute or so. Super helpful. And it looks like a lot of us have been advancing and making progress along this roadmap, which is fantastic to see. Give it about 30 more seconds. We've got 20 of 34 responded. All right, let's end the poll. 3 minutes seems like a good time with most of us. And so if we want to share those results, we can look at them quickly together. And there should be a pop-up window on your screen if you're interested. Looks like we've had some of us here from the beginning, but it's wonderful to see half a dozen folks here for the first time. And we really want to connect with you. And if there's any reason that you want us to reach out and connect, whether you're new or old or want resources or just want to chat, we'd love to learn about you. Feel free to pop your email in the chat here. Sometimes that is easiest and most efficient when you're thinking about it, and then we can follow up with you. And so it looks like we were really spread across the readiness roadmap when we all joined the collaborative. And a lot of us are delivering services at this time. And so I think from an equitable standpoint, it's really important that we still offer these services and acknowledge organizations across the readiness roadmap, but also make sure that our resources for those delivering services is robust and has these technical issues that are addressed with these feedback loops. So this is helpful for us to continue to gear our strategy together. All right, we can stop sharing the poll. And if that window is still open for you guys, you can X out of there. Seeing some more information in the chat. Ashley is sharing that PHC does not plan to open up a third round of IPP funds at this time. I'm sure they'll keep us posted. And Elizabeth, very happy to provide information. I'm just glad we're all here today. All right, so we are going to go over process mapping together. And we know that a lot of you may be experts and well familiar with the idea of process mapping in various forms. This is why we're going to keep it short in terms of an overview of what it is and defining it and how it might be helpful for us. We know that it might be brand new for folks. And so again, if this is something you want to learn more about in depth, reach out to us and we're happy to explore it more with you. We're going over it today so we can all be on the same page to respond to the requests for people understanding the landscape, as I said in the beginning of this meeting, and opportunities and interest levels for us to be able to host more process mapping opportunities. Developing maps, exploring them, understanding them. And so given people's levels of interest, this is something that we can dive more into in a way that is helpful for each of us with where we're at. So I'm going to give it back over to Stephanie, who's going to lead this section.
Okay, thanks, Rachel. You can go to the next slide. So again, and we're talking about responses to things we've heard from all of you. And back in February, we did some what are called discovery calls. We just wanted to listen and hear how things were going, how far people were in the process, and what were the challenges or what were your needs. And we noticed that consistently we heard the word process, you know, how we don't know what I'm doing, or not with everything, but it doesn't feel like there's a streamlined process, and some things are unclear. Now, I will say that personally, I've said this before, not everyone agrees with me, but personally, I feel like CalAIM itself, and specifically Path within it, is very well strategized. But it's huge, right? There's a good strategy to it. I think there's a lot around the implementation. They've put supports in place, even just the fact that you have facilitators. We may not like the regions, but every region has professional facilitators to help support you. There's communication structures, there's PCG. So I think that, you know, there is a structure to it, but I agree. I've searched and looked and asked a lot of places, is there a documented process for this? Like, you know, getting up to signing up with a contractor or contracting with your MCP, and the billing. And some people have made them. A lot of you have sent in cheat sheets, but there really aren't official, what I would call like visual process maps of some of these. And so it's a lot to read through. And all of you are providing important services on the ground, taking care of patients, finding people homes and showers. So it's just a lot of information. I would say the one word we universally hear is overwhelmed. And so we wanted to just do a check-in on what may or may not be helpful, or talk about some of those options. So we can go to the next slide. So with the word process coming up a lot, we imagine that a lot of you have heard of process mapping. You may have heard it called workflow mapping, flowcharts, I don't know, visual diagrams, lots of different things in those ways. So it's often a box of shapes connected with arrows. It can be drawn in swim lanes, like bars going across the screen. There's lots of different ways to do it. But it really, the important part to it, and you can see the definition here, it's really looking at the steps in a sequential order to any process. And it often leads to a decision. It doesn't always. It's sometimes looking at the way that you do things. And the steps are kind of listed and defined there. To me, the most important part of process mapping is the process itself, is getting the group of people involved in this to talk through and discuss what order do we do things with? When do we make decisions? What do we need for this to be successful? What's stopping us? And just that conversation and having to stop and actually put it in a small box or write it down lets you really examine what you're doing, what's stopping you, and all the different things happening throughout it. So it's really the conversation. And to be honest, sometimes when I look at a process map with all the boxes and squares and circles, it's a lot for me. But talking through how we got to those squares and boxes is amazing. It really adds clarification. So I'll show you a sample of one type of a process map. And this one is really kind of made up. You can zoom in it a little bit. I don't know who was doing that before, but it was nice. And it's like, this is one map that I haven't been able to find that seems to me like it would be really nice to have. And I won't walk you through the whole thing, but let's say that I'm a street outreach provider, and I think that our organization might want to be an ECM provider, but I'm not totally sure that we can kind of handle the administrative burden and that it's going to be financially sustainable, but I think it might. And so what are the steps? And really, if you kind of think about it, well, first we should contact our MCP or contact PHC just to get some information. But a lot of folks are nervous just make that step because they don't want to be committed. But anyways, so mapping out this flow would really help some of our community-based organizations, you know. And then once we contact PHC and have some of the information, then we can start thinking about it. Well, what are the, you know, which populations do we want? We didn't even realize we had to choose certain populations. What's the operational impact? What's the financial impact? And then in orange, those are like the predetermined parts of it. Well, according to DHCS, we have to do this, this, and this. Are we ready for that based on what we discussed? And then green, blue is decision points. The diamond is decision points. I always forget this stuff. And then, you know, and then the green trapezoids are internal process discussions. So with the information in the 2 steps above, we have to internally discuss, are we ready for this? And then what comes after it. So it's really like, it's about the conversations that happen and knowing the steps before you get to contracting. And then there's a yes and a no in those blue diamonds. We could say, yep, we've looked at everything. We feel really good about the financial, the administrative, and the operational. And we're going to say yes. And we know that we want 2 populations of focus. That's what's going to work best for who we currently serve. Or we might say, no, we don't feel confident that we're actually ready to do ECM yet, but we might in 6 months. And we do feel like we can start with community supports because we already do housing navigation and a couple of the others. So it's just kind of, this is what I'm shocked there. I can't find a process map for this yet, but that's the concept of a process map or process mapping. You can go to the next slide. And it doesn't have to be anything major. You can really do it for anything. It doesn't have to be a huge decision. And so if we were all in person, this is a really good exercise to do, to think about what are the steps in a process. I would have you all write down how to make a peanut butter and jelly sandwich. This is a really fun one to do, unless people are allergic. We might have to do something else. Anyways, and like if you look at this picture, my instructions, I would never say to put jelly on top of peanut butter because that seems wrong, but maybe then the jelly doesn't soak through the bread, right? But by doing this as a team together, you're really kind of figuring out, Catherine does do that. See, and that's important. It's not wrong. But if you are filling out the billing forms to go to partnership and one person's putting the jelly on top of the peanut butter and one person isn't, then, and some of the claims are getting rejected, but some of them aren't, but you all think you're doing it, it's just figuring out the steps in that process and really streamlining it because you want every claim you submit to go through. And it might be one small thing. So I find that these can be really helpful in the discussion that comes out because there are a lot of details to that claim submission. But you know how to provide the services. We all know how to make a peanut butter and jelly sandwich. And in the end, you can feed someone who's hungry with this. But if we do one thing differently, it may get rejected. I guess that's the point of it. So that's really what we wanted to introduce is that concept. You can go to the next slide. And then we're looking again at our goals. And I actually really appreciated, Casey, in the beginning, your question to Ashley, I think was a really good question because it's something we've been talking about a lot. It's almost like it's too advanced a step for where it feels like people are at in providing enhanced care management services right now. But you hit the nail on the head with what is the best practice in this type of care provision, because ECM is based on national models of complex care coordination and integrated care management. And ultimately, we all do need to get together in a certain locale or region and see who's doing what so that we don't duplicate and figure out how to do it. And you have to have a lead care manager within enhanced care management, and you have to have care plans. But there's best practices, and kind of what Casey mentioned is one of the best practices. So within this regional collaborative, right, the Southwest region of our 5 counties, which we can all talk about, there might be counties within that or smaller groupings within that. We did agree that one of our goals is to establish a system of coordinated care across both the enhanced care management and the community support providers, because we rely on each other for improved care delivery. And we thought that having a process map that aligns workflows would be a good way to get there, but it's not probably going to be one giant map that works for everything. So we wanted to ask you, what's most helpful to you? And do you already have maps for, let's say, contracting to be an ECM provider, or to maybe convene, as Casey was saying, as organizations, well, it's a little different, like community-based organizations or all ECM providers? Or would it be helpful to have a map for doing your QIP reports? So it can be anything. And the question is really just, do you like this? Do you already do this? Is this like, oh, we do this all the time, it's no brainer? Or is this, I think, one of those things that's like, we never make time for this. We are way too busy and don't even bring this up. So we just wanted to get a pulse check on that. So that's where I'm at. And I don't know if I have time for questions. I saw that I had limited time. Okay.
Yeah, let's do a quick poll, and then we can always overlap as people are finishing up the poll. If people want to put questions in the chat or raise your hand or unmute yourself, we can do that. So here's our poll, and really it's where are we at? What do we have? What are we interested in doing or developing together, or in what form? How can we support that? So it should take probably 2 to 5 minutes. I am going to be quiet for those first couple of minutes because I know it's hard to read and hear different words at the same time. But please feel free to speak up with any clarifications that are needed in the poll, or we'll monitor the chat as well. And so this will help us meet you where you're at and provide you what you need with what is most helpful. We have a few speed readers who are through it. If you also have questions or idea suggestions, your brain is now whirring, W-H-I-R-R-I-N-G, not W-O-R-Y-I-N-G. Feel free to raise your hand with ideas, or again, put them in the chat. We know people enjoy communicating in different ways. And if you already know you want direct help on this sooner rather than later, you can also put your email in the chat, ask us to reach out to you. The submit function is grayed out. We've got some submits. I'm wondering if maybe there's one question that was missed. So my first guess, if any of my colleagues or other Zoom super users have ideas, please help us out with why someone's submit function might be grayed out. My only guess is maybe there was one question that was missed, which seems mildly frustrating. We'll give it about another minute and a half. We've got 15 of us who have responded. You know, a few more maybe working on it. All right, let's go ahead and end the poll and we can share our results. If we cut you off, I'm so sorry, but feel free to give us any feedback as well. So it looks like a lot of folks, especially providing ECM services, have mapped out some of these processes, and lots of work still happening, especially for those providing community supports. And it's just the nature of the delivery system. There is a lot of interest, especially for data sharing and care planning workflows, to be able to develop more, with lots of interest to develop them. And looks like a lot of us really want reference example maps, with some help from either one another, or that one-on-one technical assistance from us or the marketplace. And some folks would be happy to share, and the experience of process mapping ranges. So that's incredibly helpful for future activities and reaching out to each of you. So we will see the best way to incorporate that. All right, let's close the poll. And if you need to hit the X on that window, you can. All right. So we are going to run through just the last bits of information and updates we have for you. And then of course, hoping we will end on time. If we've got time for questions, we would love them. And we can also stay on an extra couple of minutes. Sean, are you here for our asset mapping demo update?
Yeah.
Perfect. So Sean is on our Merlin team and has spearheaded the effort to put together our asset maps and led a demo. So give us a quick update on that, Sean.
Yeah, thank you to everyone who joined the pop-up demo a couple of weeks ago. I hope it was really useful for everyone. And we also got a lot of useful information on our end about updates that we needed to make to the map and ways to make it more useful for all of you. The recording is available online. Something that came up a lot in both demos was individuals and organizations wanting to add their information, rightfully so. If you are looking at the map and you are seeing that your organization is not reflected and you would like to be, please just email our PAF@Pop Health Innovation Lab email. We are in the last stages of finishing an updated survey. Some of you may know that we originally launched a survey to update the map with as much details as we did in terms of like capacity of providers, ECM community supports, and other attributes of different organizations. We're shortening the survey so that it's not a 35-minute, 60-minute survey anymore. That way it's something that you can simply get a link to when you want to add your organization information, and you can just add all the basic information regarding your services, your capacity, your location, and things like that. And so once that survey is finalized and we've completed on our end, we will send it out in an email, whether it's coming from the PATH email or from Rachel or Jessica. So just keep an eye out for that. Thanks.
Perfect. Thank you so much, Sean. And if you already know that you want to add your organization to our asset maps, you can also send an email to our PATH email, and we will keep you on that list to make sure that you get the information, but we will send it out to everybody. All right, let's go over our next steps and upcoming events. So if everybody could please check your calendars, we want to make sure that you have calendar holds for our in-person meeting next month. It will be Wednesday, July 26th from 11 to 2. And if you do not have that, please do put your email in the chat. We'll make sure that you get on that list. And Jessica, any updates about confirmed locations?
Yes, I'm so excited to share that we have a confirmed location in Santa Rosa. In our follow-up emails, I'll make sure that the address and all the details will be made available to you all. It is in probably a familiar building to a lot of you. I just can't share it because I can't remember at the top of my head, but it's really close to the airport, and it seems very nice. And thanks to some of the members on this call who are helping to facilitate this coordinating this venue. More details to come.
Perfect. Thank you so much. PCG also has a survey. So DHCS really finds the CPI collaboratives important and wants this to be a useful place for all of you. And so by this Friday, the 30th, please complete the survey. We've sent it out a couple times in emails, but totally understandable if you've missed that. And so this is a way to provide feedback that circumvents us, goes directly to the administrator, PCG, that puts that data together and sends it to DHCS. So if there is something that you need from this collaborative, things that are working, things that aren't, please do send that feedback in that survey. And then of course, resources and information about upcoming events and past trainings and webinars are all on our website, so you can go there. All right, questions, requests. We have our emails there. We've put our path email in the chat a few times. Is there anything else that we can hear from you, do for you, understand? How's everybody feeling? Thank you again so much for the meeting today. It's always helpful to hear from you and have your resources and shared experiences. We will be in touch. Please feel free to reach out. I'll stop the recording and we'll be here for another minute or two if anybody has other questions that come to mind. Thank you so much and have a wonderful rest of your day and week.